Hello everyone, I'm Dr. Sneha, one of the mentors with Decode MRCOG team. And the exams are fast nearing, and here are some tips and tricks that can be useful during your exams. It is not quite uncommon for us to face a station that we are not familiar with. Most of the stations might be recalls or something associated with the recall that you've already seen. But what you do if you come across a station or a task that you don't know how to tackle. So here are a few tips that you can follow. So first, do not panic. That's the first important thing. Okay. If you panic, you'll forget whatever you remember as well. Do not fumble or take long pauses. You'll be wasting your precious 10 minutes. Quickly try to recollect some information that is similar or linked to this task from whatever you already know or from a task that is very similar that you have performed earlier, and see if you can use that information in this task. Try to follow the template that you have built. For example, if it's a role player, you can always ask history, can tell her or interpret the examination finding, investigate her or offer some investigation that you think is relevant, and also the management plan. You can also follow simple general points like being kind to the patient, not being judgmental, and checking her understanding, giving information in chunks. All these will fetch you marks in communication with patient and information gathering. So it will not be like you'll completely fail the station or you'll completely fail in all the four domains if you follow the general points that you apply for all of the tasks. The most important thing is do not give wrong information or made up information. If you're not sure of the answer, or if you're not sure of what to tell, just be honest and tell that you do not know. Either in SPT or SD, you lose marks in applied clinical knowledge, but at least they will appreciate you for being honest and for seeking help when you do not know the answer from your senior. So you'll get some points in patient safety at least. You will not fail completely. So I hope this was useful, guys. All the best for your exam.